Ladies, do you know why you have so much plantar fasciitis since you have turned 35? I know you know that estrogen is really important to how your tissues remodel, such as the metabolism of bone, muscle, cartilage, tendon, and ligament. And this affects all your musculoskeletal issues. So your plantar fasciitis has a piece of the puzzle of your hormones. You have estrogen receptors in your tendons and ligaments. Don't be surprised that there are estrogen receptors like all over. So your tendons being brittle, well, like your hormones are changing and everything else is brittle. Did you expect your plantar fascia to be supple? No. Now, it's not all physiological at the cellular level. There are mechanical reasons that you have deficits, that your plantar fascia is being stressed and having to step up to the occasion. But I just want you to know that your things that you're doing might not be enough to help us get over the hump that your physiology has changed and your estrogen isn't optimal anymore. So this study that came out in 2019 talks about the sensitivity of the fascia to sex hormone levels. And this article is basically a landmark article telling us, hey, hormones affect our tendons and our ligaments and fascia. We're not crazy because there's receptors, and it affects our extracellular matrix. But let me show you. Okay, so you know that estrogen affects how our body remodels, how our muscles, how our bone, how our cartilage, how our tendon. We have receptors everywhere, but they're just now really realizing that there are receptors in the tendons and fascia. And we should have figured it out because the women that got breast cancer and that were put on aromatase inhibitors and had all the estrogen sucked out from their body felt like garbage. And these women who then became postmenopausal and had like no hormones left experienced joint pain and musculoskeletal aching. I should have known this too. Why didn't I put it together? So then the thought is, if that's the case, then we could actually help women with estrogen replacement therapy, which would be called hormone replacement therapy, which would be called menopause hormone therapy. In postmenopausal women, it could be that maybe this hormone that you would get, the estrogen, let's say, could help you have a better connective tissue and help your pain, because the estrogen affects your tendon biomechanical properties and morphology at the cellular level. Now, yes, we still have to correct your biomechanical deficits, okay? But at the cellular level, you were set up for failure. So estradiol could help maintain homeostasis in female connective tissue. Estrogen can help you have less orthopedic pain. So in this experiment, they added estrogen to the cells. Here it is. And this was the first study that they found that the human fascia can respond to various hormonal stimuli regarding the production of some components of the extracellular matrix, collagen 1 and collagen 3 and fibrillin. And basically how the extracellular matrix is composed and what it's made up of affects the behavior of the tissues. And so we have receptors for estrogen in these tissues. And if your estrogen goes bye-bye, then your extracellular matrix changes and then bad things happen. So the extracellular matrix is really important for how our tissue behaves. So let's take the cervix, for example. The progesterone and estrogen play an important role in how the cervix will work and how it regulates synthesis, processing, assembly, structural reorganization of both collagen and elastic fibers in the cervix during pregnancy, regulating the mechanical function of the tissue. So we were always meant to have hormones regulate the mechanical function of our soft tissue. It makes sense when I say it like that. And as you enter perimenopause, menopause, and as your hormones shift, and as you enter menopause and postmenopause, you're going to become more rigid with the low hormone levels, and the fascia becomes enriched in collagen 1. So there's like an imbalance between the type 1 and type 3 collagen, and the fascia isn't as supple because our hormones aren't regulating. And if we look below, other studies related to the skin have already demonstrated the changes in collagen lead to diminished skin elasticity and strength.